Hello everyone, my name is Mavish Hassan and I will be presenting breast cancer and mammogram awareness campaign. A little bit of background. Breast cancer is one of the most common cancers in women and among the leading cause of death from cancers. According to WHO, 2.3 million women were diagnosed with breast cancer and 685,000 deaths were reported in 2020 globally. Breast cancer is the world's most prevalent cancer with 7.8 million women alive who were diagnosed with breast cancer in the past 5 years. In the United States, it is the second most common cancer among women. According to the data from Kaiser Family Foundation, incidence rate of breast cancer in the USA is 126.3 per 100,000 women. It means that about 1 in 8 women in the United States will get breast cancer during her lifetime. Women should be aware of this staggering statistics. For my target audience, it is women 40 years and older because approximately half of breast cancers develop in women who have no identifiable breast cancer risk factor other than other than age, which is 40 years and older. Other stakeholders, core members of the team responsible for strategic planning and advising of the campaign include policymakers, healthcare professional researchers, administrators, financiers, patients, advocates, and cancer survivors and general population. A little bit of mammogram. Screening for breast cancer can be done by mammogram. It is an X-ray picture of the breast. The type of radiation used by mammogram is a very low level of X-ray. The risk of harm from this radiation is very low, that makes it safer to use and an ideal method of screening. A health campaign for breast cancer and screening awareness is urgently required among middle-aged women because it is one of the most treatable cancers and if caught early can be cured. It is fortunate that mammograms can detect cancer early before it metastasizes to other parts of the body. For campaign goals of the campaign is to raise awareness of the importance of mammography, which helps in early detection and treatment of breast cancer. Campaign should address the stigma related to breast health education, breast health, and educate women about their susceptibility even without any symptom or family history. It also includes the information regarding safety of mammogram that can help ease the anxiety related to exposure to X-ray and radiation. For my campaign, I chose health belief model. In health belief model, people's beliefs about the disease and interventions influence their health-related behaviors or actions. Health promotion campaign addressing the susceptibility and severity of breast cancer can result in adoption of healthy behavior. In this case, it's mammography. In a successful campaign, benefits should outweigh barriers. Self-efficacy can be promoted in campaign by finding service provider, finances, and preparation for getting a mammogram. For campaign strategies, health belief model based educational interventions can increase the motivation of breast screening among women. There are several outlets that can be utilized to raise awareness. Most places accessed by women above 40 years of age are salons, gyms, physician's office, children's school, religious or community centers. Brochure or pamphlets can be used in print media to raise awareness. Perceived barriers like poor knowledge and language barriers in older women, workshops can be organized in colleges to teach young girls about the breast screening and its effectiveness. They are then encouraged to educate older women in their families about the screening and mammogram, and it will help help older women to perceive susceptibility and severity and remove barriers. Social media like Facebook, Twitter, and Instagram can also be used to spread awareness among women, and it can also be used as frequent reminders. At government level, insurance companies should be mandated to cover the cost of mammogram. It can remove the financial barrier, and mammo vans are mobile mammography vans that can increase self-efficacy, and it can also remove transportation barrier. In the end post implementation evaluation process, evaluation of mammogram and breast screening consists of monitoring the progress through tracking number of inquiries, checking distribution points to access materials used, and follow up with experts and practitioners to evaluate their capacity to address the breast screening and mammogram. By comparing pre-campaign and post-campaign surveys, it can be determined how effective the interventions were. These are the reference, and I hope you enjoyed this presentation.